When the first explosion report reached Memorial Hospital's emergency room over the PA system, everyone began running around in panic, while ER nurse Michelle Jones was organizing patient files. When 15 critically injured patients arrived at the emergency room simultaneously, Michelle immediately took position. "Call the doctors," she told the head nurse. "This is a very big situation." The head nurse looked worried. "Michelle, the doctors are in the operating room. It'll take at least 20 minutes. We can't handle this many injured patients." But Michelle was already putting on gloves because those sounds weren't foreign to her, and in the next 8 minutes, everyone at the hospital would learn who Michelle Jones really was. Because some people wear nurse uniforms, but never remain passive. Welcome to Hidden Legends. Before diving into this powerful story, tell us in the comments which city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Michelle Jones was exactly what she appeared to be at Memorial Hospital. A 34-year-old experienced emergency room nurse, medium height, strong build, blonde hair, always in a neat ponytail. She'd been working in emergency medicine in Boston for 5 years, spent weekends reading books, and had never neglected a single safety procedure. What her colleagues couldn't see was the past that lived behind those calm blue eyes. 12 years ago, Michelle was Petty Officer First Class Jones, United States Navy SEAL operator. 2 tours in Somalia, 3 in Afghanistan, 2 in Iraq. As a field surgery specialist, 143 successful operations. She had saved the lives of more than 400 soldiers in the world's most dangerous field medicine operations. But Michelle never talked about that life. Not to Chief Physician Dr. Williams, not to other nurses, not even to herself if she could help it. She had built a new identity based on civilian medicine, deliberately choosing the most ordinary nursing career possible. What Michelle didn't know was that in exactly 8 minutes, all that field medical training would surface whether she wanted it to or not. The night shift started normally. Michelle was on night duty at Memorial Hospital's emergency room, 11 p.m. to 7 a.m. 12 patients, mostly routine cases, some under observation. Michelle and her colleague nurse Jennifer had developed the kind of partnership they'd built every night. Wednesday, March 15, 2024. As Michelle organized patient files at the ER nurse station, she was doing her usual routine check. Equipment control, medication inventory, emergency protocols. Everything was perfect. "It's very quiet today," Jennifer said. "I wish it would stay this way." But Michelle's trained ears always tracked background noise. Ambulance sirens, radio traffic, hospital activity. Navy SEAL training had taught her situational awareness. This habit had never left. At 11:47 p.m., when the hospital PA system announcement came, she would be proven right. Everything changed. The hospital PA system activated. Code red. All emergency room personnel. Major industrial explosion in downtown. Multiple trauma cases incoming. All personnel to emergency room. Michelle immediately stood up. This wasn't just a routine call. Code red meant mass casualty. "Michelle," Jennifer said in panic, "this looks very big. There's been an explosion at the chemical plant." Michelle observed the background activity. Hospital personnel running, ambulance sirens approaching, emergency protocols activating. This was a serious mass casualty event. "Jennifer, stay calm," Michelle said. "Everything is under control." But Michelle was doing threat assessment in her mind. Multiple injuries, probable severe trauma, many wounded, limited resources. This was a field medicine scenario. Ambulances approached the hospital. Michelle took preparation position. Minutes later, the first injured began being transported to the emergency room. Ambulance crews began bringing the injured to the emergency room. Casualties from the chemical plant explosion, chemical burns, blast injuries, shrapnel cuts, signs of internal bleeding, respiratory tract damage. Michelle immediately made a triage assessment. 15 critically injured factory workers aged 25 to 55. Critical situation. "Michelle," head nurse Susan came running. "This is huge. Dr. Williams and Dr. Chen are doing heart surgery in the operating room. Dr. Rodriguez is at another hospital for consultation. It'll take at least 20 minutes for them to get here." Michelle assessed the situation. 15 critical injured, only 2 nurses, no doctor. Under normal protocol, this was impossible. Susan, ambulance crews are continuing to bring injured, Michelle said in a calm but authoritative voice. I'll do triage. Michelle, you're a nurse. How can we prioritize this many injured without a doctor? Michelle's answer surprised Susan. I'll coordinate. You prepare medications. Michelle, this isn't your area of authority. But Michelle was already putting on gloves because those explosion sounds weren't foreign to her. And in the next 8 minutes, everyone at the hospital would learn who Michelle Jones really was. Michelle quickly reviewed the injured. 12 years of Navy SEAL field medical training automatically kicked in. This wasn't the field hospital in Afghanistan, but the principle was the same. Prioritize, stabilize, save lives. Patient 1, 45-year-old male, chemical burns 30% of body, conscious but in pain. Patient 2, 38-year-old female, blast injuries, probable internal bleeding, hypotensive. Patient 3, 52-year-old male, breathing difficulty, chemical inhalation, cyanotic. Michelle quickly triaged. Colored tags: red, critical; yellow, stable; green, minor. Susan, Michelle used her command voice. Open 4 access for red-tagged patients. Start fluids on patient 2 immediately. Michelle, this is doctor's work. Susan, now is not the time. Michelle's voice was firm and authoritative. Give patient 3 oxygen, 100% non-rebreather mask. Susan had never seen such a Michelle. This calm, gentle nurse had suddenly taken command. Time 002. Michelle started her mental chronometer. She needed to stabilize 15 injured in 8 minutes. Patient 2 was critical. Michelle quickly assessed abdominal rigidity, rebound tenderness, hypotension, internal bleeding, probably splenic rupture. Navy SEAL field medicine protocol. Establish large IV access, aggressive fluid resuscitation, control bleeding. Susan, 14 gauge 4, 2 sites, Ringer's lactate wide open, check blood pressure every 2 minutes. Michelle, this requires surgery. Susan, there's no operating room now. We're in the field. Michelle's hands moved with surgical precision. I'll stabilize. Doctors will be ready when they arrive. Patient 3 had chemical inhalation. Michelle assessed the airway. Edema, bronchospasm, low oxygen saturation. Jennifer, Michelle called to the second nurse, bronchodilator nebulization for patient 3, salbutamol 5 milligrams, stat. Jennifer froze. Michelle, this requires a doctor's prescription. Jennifer, that man is dying. Either you give medication now or you let him die. 4th minute. Michelle's hands moved with battlefield precision. Patient 1's chemical burns required emergency decontamination. Michelle started copious irrigation with saline solution. This was much more aggressive than standard protocol. Susan, pain management for this patient. Morphine 4 milligrams IV, but stabilize BP first. Patient 7 had shrapnel wounds. Michelle quickly assessed neck area, near major vessel, but no active bleeding. Risky removal, but stable. Michelle's hands carefully moved the shrapnel, controlled extraction. The technique was perfect. Jennifer watched in amazement. Michelle, this is a surgical procedure. Jennifer, field surgery. I learned it in Afghanistan. 5 minutes passed. Michelle had stabilized 8 of the 15 injured. Navy SEAL field medical training was operating at full performance. 6th minute. Dr. Williams came running into the emergency room. He had left cardiac surgery to come, ready to handle the multiple trauma case. The scene he saw shocked him. 15 injured systematically arranged, marked with colored triage tags. IV lines open, vital sign monitoring being done, pain control provided. Michelle in command position, Susan and Jennifer working in coordination. Michelle, how is this possible? Dr. Williams was trying to comprehend the scene. Dr. Williams, critical patients have been stabilized. Let me report the details. Michelle began giving a professional briefing. Patient 2, probable splenic rupture, BP stabilized to 90/60, 2 IV lines established, ready for surgery. Patient 3, chemical inhalation, good bronchodilator response, oxygen saturation raised to 94%. Patient 1, 30% burns, pain control achieved, ready for debridement. Dr. Williams was left speechless. This report was at attending physician level. Michelle, Dr. Williams asked carefully, these assessments and interventions, they exceed nursing level. Where did you learn this? Michelle hesitated. It was time to tell the truth she'd been trying to hide for 5 years. Dr. Williams, I'm a former Navy SEAL, field medicine specialist. The emergency room fell into silence. Susan and Jennifer had stopped and were listening. Naval Special Warfare? Dr. Williams repeated. What do you mean? 12 years active duty, field surgery, combat medicine, mass casualty management, Afghanistan, Iraq, Somalia. This is my training. Dr. Chen also entered the emergency room, heard Michelle's explanation. You, Dr. Chen said slowly, you're a real battlefield surgeon? Yes, doctor, but here I'm just a nurse. Time 0010. Exactly 8 minutes had passed. Michelle stopped her mental chronometer. 15 injured, all 15 stabilized, none lost, all ready for surgical intervention. This was the perfect application of Navy SEAL field medical training in a civilian hospital. Dr. Williams checked each patient individually. Triage correct, interventions appropriate, stabilization excellent. Michelle, Dr. Williams said admiringly, this is extraordinary. You stabilized 15 critical patients by yourself. This is normally impossible. Dr. Williams, I just applied my training. Field medicine teaches working under field conditions. Dr. Chen called hospital director, Dr. Martinez. Director, you need to come to the emergency room. There's an incredible situation. 30 minutes later, Dr. Martinez came to the emergency room. The 15 injured had now been distributed to appropriate services, surgery schedules made, all in stable condition. Dr. Williams, what's the report? Director, something extraordinary happened tonight. Nurse Michelle Jones stabilized 15 critical patients in 8 minutes by herself, using field surgery techniques. Dr. Martinez looked at Michelle. Nurse Jones, is this true? Yes, Director. I applied my training. What training? Michelle took a deep breath. Navy SEAL field medical training, 12 years active duty. Dr. Martinez sat down. You were a Navy SEAL? Yes, Director. But now I'm just an emergency room nurse. Michelle, you're not just a nurse. You're one of this hospital's most valuable assets. A week later, Michelle was called to a meeting with hospital management. Michelle, Dr. Martinez said, we want to make you an offer, trauma coordinator position. You'll train emergency room nurses in field medicine techniques. Director, I love working as a nurse. Michelle, you'll continue as a nurse, but you'll also share your expertise. Let other nurses learn your techniques. Let's be ready for mass casualty situations, Michelle thought. Maybe Navy SEAL training could help other nurses too. I accept, Director, but with one condition. What is it? I'll still be responsible for patient care. That's my real job. Dr. Martinez smiled. Of course, Michelle. You're a legend. Michelle, Susan said the next day, we've worked together for 5 years. I never would have imagined. Susan, I'm the same Michelle, just I have additional skills. Additional skills? Jennifer laughed. You're a war hero. No, Michelle said seriously. I'm a nurse. War just taught me to do patient care under difficult conditions. We'll never forget that night, Susan said. You saved those 15 people's lives. We saved them, Michelle corrected, as a team. Michelle still works the same emergency room shifts, still organizes patient files, starts IVs, talks with families. But now she also mentors new nurses, organizes mass casualty drills, provides training at other hospitals, runs support groups for veteran nurses. Michelle, young nurse Jessica asked, do you miss the Navy SEALs? Michelle looked out the emergency room window. Ambulances coming, patients recovering, families reuniting. I miss it every day, she said, but now I have a different mission. What is it? Saving lives in peacetime. No war, but the mission continues. That night going home, Michelle thought about the lost operation in Somalia, but also about the factory workers she saved today. Every saved patient compensated for a part of that lost operation. The phone rang. Hospital. Michelle, major traffic accident, multiple injuries. Can you come? Michelle grabbed her keys. On my way. Because real legends never stop. Only the duty location changes. From battlefield to emergency room, from combat to care, from Navy SEAL to nurse. But the mission is always the same. Save lives. Have you ever met someone like Michelle Jones? Medical personnel whose real background you didn't know? Where you only saw extraordinary competence? Share in the comments. Because at Hidden Legends, we know that the greatest healers often wear the most humble uniforms. If this story moved you, share it, subscribe, and support the continuation of these important stories. Remember, on your next emergency room visit, the nurse treating you might be exactly who you need them to be. Service never ends. It just takes new forms.